morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. You can also make use of it. Now as we know, we were discussing about the dosha analysis. In that also, now we are dealing with the Atma gunas of the Vata. We are trying to understand the Vata, how clinically we can correlate the things. Now, two types of clinical presentations are seen as far as Vata Prakopa is concerned. Two major causes of Vata Roga, that means how a Vata can undergo Prakopa. There are basically two causes for that as explained in the classics. One is Dhatukshaya and another one is Margava Roga. These are the two important routes, or you can say pathologies, through which the Vata undergo Prakopa. Now if you look in the Margava Roga, there is some block in the channel or shrotas, and that is leading to the problem. Now when we look into the presentations of Vata Roga, so two types of presentations. One is an acute presentation and another one is chronic presentation. When I talk about Margava Roga Janya Vata Vyadis, so most of them are acute presentation, and either they are acute presentation or they are produced from Santarpanotha causes like Divasopna or Prameha Hetu, etc. These references are there in the classics. So Margava Roga leading to Vata Rogas or Vata Vyadi, so that is most of the time acute presentation. Now paralysis or what you say Pakshagata, so it's acute presentation. Okay, the cause is Margava Roga. Then Santarpanotha causes, sometimes there may be atherosclerosis like conditions, abnormal deposition of the fat or some other wrong lifestyle disorders, lifestyle related disorders. So there's all Santarpanotha Rogas leading to Vata Vyadis. Okay, so what I mean to say is Margava Roga Janya Vata Vyadis are, most of them are acute presentations, and Santarpanotha cause is the main one, and it is associated with the other doshas. Okay, so in Margava Roga, although Vata is basically involved, there is also some association of Pitta and Kapha. Okay, as we witness in case of Santarpanotha causes. Although there is Vata Prakopa or Vata Vyadi is there, but there is also involvement of Pitta and Kapha. Similarly, for example, storage disorders, we have got in the pediatric practice so many storage disorders, Niemann-Pick's disease and so many other storage disorders are there, Wilson's disease, etc. Now, Niemann-Pick's disease are like storage disorders where the abnormal content or abnormal metabolic content is coming and gets stored in the body, maybe in the brain or nerve-related areas, leading to the cause. So this is not purely Vataja. This is because of Margava Roga caused by that storage material. Storage material is causing the Margava Roga, and presentation is most of the time acute when it reaches the peak. So many metabolic disorders, vascular causes. See, vascular causes always cause the acute presentation. It may be paralysis, rupture of the vessels, thrombosis, okay, formation of the edema leading to compression. Most of the time they are acute presentations. Not most of the time, always they are acute presentation. When there is involvement of the vessel, etc., there is always acute presentations. So then I can say Margava Roga Janya Vata Vyadis are something related to acute presentation, maybe Santarpanotha Janya causes associated with the other disorders, maybe as seen in case of storage disorders, metabolic disorders, vascular causes, etc. Another presentation of the Vata Vyadi is Dhatukshaya Janya Vyadis. So Dhatukshaya is not an acute presentation, it is a chronic presentation. The progression is very slow and gradually it go on increasing. Okay, gradually increasing presentation. Most of the time the causes are Apatarpanotha causes. Okay, Dhatukshaya related causes, maybe the degenerative causes or some nutritional causes may be also there. The cause is always Apatarpana Janya, not Santarpana Janya. So certain degenerative disorders or demyelination disorders or desquamation disorders and many other spinal muscular atrophic disorders, so they all comes under the Dhatukshaya Janya Vata Vyadis. So Dhatukshaya leading to Vata Vyadi. Emaciation also occurs in the malnutrition, which is not related to nervous system. This we have to remember. Dhatukshaya always leads to Vata Vyadi. Okay. Now, emaciation is a type of Dhatokshaya, and that emaciation is not mandatory that it always occurs in case of neurological disorders only, as we see neurological degenerative disorders like that. That particular Dhatokshaya or emaciation can be also seen in nutritional disorders. Therefore, I told in the Apatarpana cause. Apatarpana is not only because of degeneration, Apatarpana may be because of the, what we say, nutritional also. So this is the point. So these are the two important presentations. Now, Kevala Vata Vyadi, when we talk about Kevala Vata Vyadi, Vatena Janita Asadharana Vyadi is Vata Vyadi. Only purely Vata. Okay. Asamishtra Vata or Anavrta Vata. Avrta dosho lingani, so anemiyata will be there. Okay, that is where only Vata is involved. There is no association of other two doshas. Now, when we look into some of the examples of Vataja Atma Rupas, as already we have explained, Rauksha. Rukshatva is always Atma Rupa of the Vataja Vataruga. Okay, Vataja Atisara lead into dryness of the mouth. Ruksha side there. Okay, protrusion of the anus will be there. Sandhigata Vata lead into painful active and passive movements. Okay, Shakrit Graha is there, constipation. See, all these things are explained in the Raukshata. Basically, these are the Vataja Rogas, and their Atma Rupa is coming in the form of Rukshatva. That is, Ruksha Guna is increased. See, Vataja Atisara, there will be dryness of the mouth. That is Rukshata of the mouth. Okay, there is the Sandhigata Vata. Okay, again, Vata, Rauksha Guna is increasing, leading to painful active and passive movements. Similarly, Shakat Graha, constipation when it is occurring, it is Vataja. Because of the Ruksha Guna of the Vata, constipation is happening because of absorption of the water. Similarly, Shaitya. Shaitya, Stambha, Kampa or Anila Mudata. Okay, Shaitya Guna will be presented when Shaitya Guna is increasing, there will be Stambha or there may be Kampa or there may be Anila Mudata, as we witness in case of Amavata. Okay, then Laghava, one more Atma Rupa of the Vataja Rogas. In Udavarta, leading to Pratilomana Gati. Okay, so Udavarta is leading to Pratiloma Gati. Jwara leading to Bhakshane Ashakti. In case of Jwara, leading to Bhakshane Ashakti. Then Mutra Graha caused by Vega Varoda. So these are the examples where the Laghavatva will go into increase. One as a Atma Guna of the Vata Rogas. Vaishada or Vishadatva. Dysfunction due to impaired malnourishment or impaired nourishment or oxygen or Abhyantara, Visarpa, Visha. These are the examples where Visha, the Guna is going to increase. In case of Visha, Abhyantara, Visarpa, etc. Gati is affected. Gati is one of the Atma Rupa of the Vataja Roga, affliction of the Gati. As we see in case of Hridrava. Then in case of Apasmara, we find Utpindika. Utpindaksha, that means Pindavaga is get affected. That means what is a cough muscles. Okay, Pindikodishta. That is in case of Apasmara. Similarly, Anavasthitatva is one more Atma Guna of the Vata. Anavasthita Chittavam. Vataja Nanatmaja Vyadi. It is also considered under Vataja Nanatmaja Vyadi. Agama, Apagama, Kshoba. Agama, Apagama, Kshoba. So this is seen in case of Vata Jwara. Anavasthitatva. Okay, frequently changing it is. So these are how some of the Atma Gunas of or Atma Rupas of Vata. Similarly, if I go for Guna analysis of the Pitta dosha, in case of Pitta dosha, while Pitta is called as Taposantape, Tapesantape, isn't it? So which means different source of generation of the heat. Pitta is something related to different source of generation of the heat by different means. This refers to different metabolic process at digestive and cellular level. Totally, those all factors which are responsible for generation of the heat, it may be enzymes, it may be hormones, okay, it may be intracellular factors, intracellular enzymes, cofactors, okay, it may be sometimes cofactors. So these are all considered under the Pitta because it is something related to generation of the heat. Word Tapa refers to Tap. Tap means alochane, which means sitting at a place with continuous thinking about a matter. Okay, Tapa, Tapasya, Tapa. So Tap alochane, that means sitting at a place with continuous thinking about a particular matter. Okay, santape, continuous sitting also produces heat. We know that. Sitting at a place continuously also produces heat. Similarly, upavasa is also considered as tapas. Because of upavasa, the catabolic process takes place in the body. Okay, there is clearance of the wastages, the metabolism increases, and resources will be coming to the circulation. Okay, storage materials will be, and ultimately catabolism will take place. Metabolism increases, and there is generation of the heat. So all these things are interrelated. Okay, so therefore the word tapa refers to production of the heat. Now, daha is one of the very important Atma Laxana of Pitta Rogas. Okay, whenever you find daha is the Atma Lakshanas. So daha is generalized presentation of the heat, and Sweda and Arati together indicates the Osha. What is the difference between daha and Osha? In daha is generalized presentation of the heat. Whereas Sweda means whereas Osha means there is a Swedatva. Due to heat there will be Swedatva, and as well as Arati, discomfort is there. While Chosha is a localized burning sensation without sweating. Okay, see, Osha is with sweating, whereas Chosha is without sweating. Sweda Rahita Agni Archishaha Meva. Okay, so Archi means heat, so or fire. So now this is the difference. Daha is a generalized representation of the heat. Sweda plus Arati together is called as Osha, and without Sweda, a local burning sensation or localized burning sensation, it is called as a Chosha. When same occurs in Mukha, the same that is Chosha, when it burning sensation, when it occurs in the Mukha Bhaga, Oshtabhaga or Talu Bhaga, the same it's called as Dhava. Same in the Chakshu and Indriya Bhaga, it's called as Dhavatu. Okay. Same occurring in the Pani, Pada and Amsa Pradesha, that is limbs and shoulder, it is called as Vidaha. Well, same when it is occurring in the Koshta, that is called as Antardaha. See, this is the difference, and these are all actually basically Daha is one of the very important, Atma Lakshana of the Pitta dosha. These presentations are different. It may come in the form of Daha, Osha, Chosha, Dava, Davatu, or it may be coming in the form of Vidaha, or it may be coming in the form of Antardaha. Now, in Daha, we have increased Ushma Guna. What happens in Daha, the first one, Daha, there is increased Ushma Guna. So, treatment should be given to the Shita Chikitsa. So, Tikta Kashaya Madura Rasa should be given. Pittahara, purely Pittahara. Kashaya Tikta Madura, Pitta Manyetu Kurvate. If only Ushma is increased, okay, in Daha, usually we have increased Ushma Guna. If only Ushma is increased, then Tikta Rasa is given, as we done. It's well and good. Same is also true in case of a Jwara. In Jwara, it is generalized, Daha. Okay. But if the Ushna and Tikshna both are increased, suppose you get a condition where Ushna is increased and Tikshna is also increased, then the Tikta Rasa will not going to work. Then you have to go for Kashaya Madura Rasa. Okay, Kashaya Madura Rasa. See, Ushna and Tikshna both are increased in case of Rakta Pitta. So in case of Rakta Pitta, the Tikta Rasa itself is not the treatment. There we have to go for Kashaya and Madura Rasa both. Kashaya and Madura Rasa both, because Ushna, not only increase Ushna is there, there is also Tikshna. So for that you have to go for Kashaya. For Tikshna you have to go for Madura Rasa. Okay, so Kashaya and Madura Rasa should be given in case of Rakta Pitta. One of the best example where Ushna and Tikshna both are increased, that is Rakta Pitta. Only Ushnatva is increased, that is Jwara. When there is increase of Tikshna Guna, Madura Rasa is indicated, as I told, because Tikshna indicates increased movement. Anyway, so do the Stambhana by Madura Rasa. Tikshna, one is sharp nature, but Tikshna also indicates the increased movement also. There is a reference. Okay, so here you have to do the Stambhana by using the Madura Rasa. Increased Tikshna Guna causes destruction, just like the Antar Visarpa. So you cannot allow the Tikshna Guna to get increased as in case of Rakta Pitta, because it causes destruction of internal organs, just like a Antar Visarpa. Okay, so this is about the Daha or Daha Guna as a the Atma Guna of a Pitta. Another Guna which is Atma Guna of Pitta is Paka or Pakita, Paka, which is nothing but Paka, suppuration. Okay, so Paka is one condition where we have increased Tikshna Guna. Why Paka occurred? Paka is occurred because of Tikshna, Ushna and Tikshna both. So Tikshna causes early Paka stage. Now, another important Atma Guna of the Pitta is a Sweda. Sweda is one more Pitta Guna. If the Sweda is increased, it suggests increased Ushma Guna, as we said in case of Osha. Okay, increased Ushma Guna. So go for Shita Guna Chikitsa, so administer Tiktarasa. Go for Tikshna Guna Chikitsa, so therefore we have to administer the Tiktarasa. Kleda is a condition, another is a Kleda related to Pitta. Kleda is also indicative of Pitta Atma Guna. Kleda is a condition where there is Mala Ardrata. Mala Ardrata, indicating the increase of Drava Guna. Pittam Sasnehati Ishtam Lagu Visram Saram Dravam. Drava Guna is also part of the Pitta Guna. So increase in the Drava Guna. In this condition, drugs like Shoshaka drugs should be given. Okay. One more is Kota. Kota, increase in the Kota is also suggestive of Pittaja Atma Guna. So Kota suggests the Puti Bhava. Suppuration is there. Pus formation, Puti Bhava, or necrosis. Now, which is actually manifestation of the Tikshnatva of the Pitta. This is also because of Tikshnatva. Tikshnatva leads to Paka, and if further if increases, leads to Kota. Now, very important is Murcha is also considered as Pitta Tamapraya. Pitta Tamapraya. Murcha is also because of Pitta, where there will be Chetana Chuti and there is increased Ushna Guna. So again, in case of Murcha, we have to go for Shita Chikitsa. In case of Murcha also, there is Chetana Chuti is there. Okay, and there is increased Ushma Guna is there. So again, in Murcha also, we have to consider Pitta increasing, because Murcha is because of Pitta and Tama. Now, Shita Chikitsa may cause increase in the Tama. Okay, that's the question. But in case of Murcha, Pitta Vriddhi is more than Tama Vriddhi. Tama is because of Kapha. Tama and Kapha are interrelated. Okay. Now this already we have seen. Now, some of the examples of Pittaja Atma Rupas. Some of the examples of Pittaja Atma Rupas. For example, Osha or Oshatva. Osha. Osha is in case of Pitta Jwara or Shofa, rise in the temperature. Tikshnatva, as I told, can be Tikshna Guna is increased in Pitta. Same in case of Madatyaya. Tikshna Guna is increased. Visha, Tikshna Guna is increased. Angapatana. Okay, Angapatana is considered as one of the Upadra of the Kushta. There also Tikshna Guna of the Pitta is increased. Visarpa, Tikshna Guna of the Pitta is increased. Pittaja Prameha Upadrava, Tikshna Guna, there is suppuration is there. Mushkavadharana, etc. So it is again Tikshna Guna of the Pitta is increasing. Similarly, Drava Guna of the Pitta is increasing. One thing is Drava Guna is increasing in case of Kotha, then Vispotha, Pittaja Atisara, Pittaja Kushta. To some extent, in case of Raktapitta. In Raktapitta, Tikshna Guna is also increased, but Dravatva is increased. Rakta ka jo hai Dravatva hai, that is increased. Anyway, Saratva, we find some disorder where Saraguna of the Pitta is increased. For example, Abhyantara Visarpa, Saraguna is increased. Okay, then Anatisneha. Anatisneha, so this is in Kamala and Pitta Jameha, etc. Similarly, we can go for the Guna analysis of the Kapha dosha, whereas Kapha refers to Shlish Alingani, which refers to binding, attachment, or a combination. Now, what is the Guna of the Kapha? One of the main Guna of the Kapha is Sneha. So, when it is increased, Atisneha, we will call it as Atisneha. This may lead to Pandutva. This may lead to Pandutva. So, now details of the Guna analysis of Kapha, so that we will see in the next class. Thank you very much.